from the Emirates indeed. We're talking about learning difficulties. Now, this is something that most of us have experienced when we were in school, and most of the parents sometimes have to face that reality. There are occasions where people are not willing to acknowledge that their child or their someone within their own household has had learning difficulties. So to talk to us in greater detail about normalizing it and also developing and increasing more awareness about it, and also shed light on the survey that they're conducting at the moment, the director of Sharjah Centre for Learning Difficulties, Dr. Hanadi Al Suwaidi, is here with us. A very good morning to you.
Good morning, and thank you for this opportunity to speak about a very important subject that usually parents and children suffer from during their academic year, and sometimes it goes beyond schooling, goes to university and their career.
Paint the picture for us. Now, when a parent come across this term, your child has learning disability, they'll say, no, he's not learning enough. He's not concentrating. He or she is not concentrating in the private tutor lessons, not listening to the teachers. Or maybe sometimes they blame the school to say, you're not teaching him properly. I do not accept my child has learning difficulties. What is learning difficulties, and are there any symptoms or signs associated with it?
Learning difficulties is a disorder. From research, they don't know exactly how it gets to the child. It's just a disorder in our minds, and then it goes in a minimum and maximum way. So and it affects learning in all the subjects. So, for example, if a child has a learning difficulty, he will not only have it in Arabic or not only have it in English, but he will have it across all the subjects he is studying. Usually, symptoms parents should consider or look at. For example, he is switching when he's learning Arabic and English, or two languages in school or three languages. He should the parents should look at, is he flipping the numbers, for example, in math, or having difficulties in reading. He cannot read, he cannot concentrate in classroom. ADHD is considered a learning difficulties because children cannot concentrate. Another symptom that if you give him a specific orders, for example, he cannot follow. He cannot follow instructions. So these are symptoms as an early intervention, or sometimes even holding the pen. Difficulties in holding the pen could be considered a sign.
How prevalent are these learning difficulties?
What I didn't get you.
What I mean is, how many people have these learning difficulties?
According to statistics, it's like 5 students in each in a 25 class, in a population of 25 students in a class.
Right.
5%, or we can say it's 5 students.
Yeah, that's a lot. That's actually a lot.
It's a lot, but it depends.
Yeah.
Sometimes people will have a minor difficulty, and then people will have an extreme difficulty.
Right. But you have so many different, for example, you've noted ADHD, there's dyslexia as well. We could name several learning difficulties and challenges for kids as well. Is it really challenging having so many aspects to this to deal with children?
If we intervene from an early stage, so for example, you cannot intervene until the child is in school and he's already studying, then you can see perfectly and clearly the symptoms and how he's affected in schools. Once he's in learning and he's in the school, then you can say, with diagnose and with investments and assessments, we can say yes, the child has either dyslexia or dyscalculia or dysgraphia or HD or ADHD. So it's considered as you said, different kinds, and sometimes kids will have different kind, and a kid will have only one kind.
Yeah.
When it comes to the language, one question that I really wanted to ask you, and I knew that you were coming today, it's very common nowadays in households to see families speaking dual languages, like, for example, English and Urdu, or English and Arabic, for example. And the child gets really confused, especially when they're very, very young, like a couple of years old, and they're starting to learn a language. And the language that they're learning, it's kind of dual. It's not Arabic exactly, and it's not English fully. So, but again, a child's brain is like a sponge. That's what I know.
I know, yeah.
Right? But still, is that healthy to kind of like make the child absorb the most at such a young age when it comes to language, for example, or information? Or is it you have to take it one by one, little by little?
I don't see a problem in learning different languages. As you said, it's a dual language.
Yeah.
And then some people comes to us that their children speak perfectly English. They're Arabs and speak perfectly English, but they suffer in Arabic.
Right.
We don't consider that a learning difficulties because he's learning English. He can read English. He can speak well in English, and he writes English perfectly. We call this a dual language because he learned English as a first language, although he's Arabic, and then vice versa with other languages. When it comes to dual languages, we don't see it difficulty. When we diagnose learning difficulties, he should suffer from every. If he's having a problem in reading, he's suffering from it in English and Arabic or any other languages he will be reading.
At what age can you trace back a learning difficulty, the start of a learning difficulty in a child?
Age, the students should be entering school. We say age 6, year 1 or 2 in schooling.
Yeah.
Grade 1 or 2, yeah.
Okay.
Can you tell us a little bit more about the role that parents play at home to help their kids process these learning difficulties? Do you think here in the UAE we're at a level of awareness where people are already equipped to handle these cases at home, or is it really hard for people? People just don't understand how to deal with these problems.
When we started the center 5 years ago, we knew that there is a problem. Parents still does not aware of that. They have a denial. Some parents do understand, and then they will seek for help, but still parents do not learning difficulties is still an early science. It's only discovered in 1950s. People before their or teachers or parents, they used to name their kids bad words if they don't learn in schools. I don't want to say it, but sometimes they call them you're stupid, you don't want to learn. Parents used to take out their kids from schools because they're not learning. Kids because of low self-esteem and some self-confidence will be school leavers. There is a statistics also showing that if we go to juvenile jails and then do there is a study that they tested in England juveniles jails, and then they found the majority of them school leavers, self-esteem low because of learning difficulties.
Yeah. So what kind of support is out there? Because there's going to, as you rightly pointed out, some parents are still not happy to accept
not
it.
Acknowledging it.
Not acknowledge it. There's going to be a lot of people who'll say it's all about izzat an-nafs, our self-respect. How dare you perform so badly in the school? And then there's also a lot of parents who'll say, well, I'm a pilot. The wife is a mechanical engineer. How did our son or daughter become this way? Is it genetic? Is it what is causing this learning difficulty?
As I said, they say it's genetic. Some scientists say it's genetics.
Yeah.
Sometimes say it's a disorder from our minds. There is a specific
ADHD, for example.
It's specific enzymes or something that are not pushed in the mind for full. But as I said, it doesn't mean that if I'm a pilot or I'm a doctor and my kids will follow, because we need to understand there is differentiations in ourselves, and even in learning. I learn differently, you learn differently, my kids learn differently. So I think with more awareness campaigns that we're doing, with more, trainings we're doing, consultation for parents, people started to understand, even teachers. Before, some teachers do not know what is learning difficulties. This is a personal thing for me. My child was diagnosed when he was grade 3 with learning difficulties. But the first school he was in, I noticed that. I told them that I've started reading about it. And then I told them, I feel that my child has problems. They said, no. He'll be okay. So see the difference between a parent and a teacher. Then I moved him to another school with a different curriculum. When I told them what I'm fearing, they said, okay, we'll test him. And then we'll accept him in the school. Then we'll do more testing on him. We'll guide you. And then my child is now in police academy.
MashaAllah.
Okay, he will be graduating next year. So he's not a child anymore.
Not a child anymore.
Okay, but this is what I always say to the parents, that you need to understand, you need to push for that. When I was a parent, I couldn't find the privilege that our parents in the center having now. There is a center. We're here to understand you. We're here to diagnose properly your child, and then we will have a plan for him. We work with the schools directly, and then we work with the parents directly.
You're talking about the Sharjah Centre for Learning Difficulties that you are a director of.
Yes.
So let's talk more into details about those methods that you guys use exactly for people or children with learning difficulties.
So first we have a checklist, and then interview the parents. We'll see the history of the child, when the parents have noticed his issues. We'll take school reports, grades reports, how he's doing in different subjects, and then this will take us to we'll do an IQ test for him to see his IQ average, because people with learning difficulties, they have average IQ and high IQ. They don't below. If they're below, they have a different kind of disability. It's not learning difficulty. Then after that, we'll do an assessment test that is including of all subject, motor testing also to check his fine motors, and then a test of speech therapy if needed.
Wow. So there is, those sort of solutions. So there is no medical treatment to it. What is because a lot of people would say, okay, I am aware that this situation is there, but I want to see the light at the end of the tunnel. I want a quick fix solution. Is there solution apart from these therapies?
See, it's not a therapy, it's a strategy. Okay, once this child is diagnosed, and then we put an individual learning plan for him once the plan is done, each member of our staff will have their own, what they call it, work with the student. So if he's only having difficulties in math, they will concentrate on teaching him method in math, memory problems if he have. So there is an individual plan. Learning difficulties will stay with you all your life. You will have it, but it's like it's like an obstacle, and then you will learn. You will have strategies to move across it, and then we will teach that. Also, we'll consult the parents of method they will use with their child, and of course the school, so that we don't have a different individual plan for the. For the students. So we will have our plan in the center, and then also the school will have a similar plan for him.
And I've just got a text from Fahima this morning saying for the SCLD, who can approach? Is it only open for Emiratis or any nationalities open?
Any nationality can approach. We used to only diagnose for Arabs, and then we're starting to diagnose also, hopefully in English, with specific English methods.
Okay. That's very good. And also the other thing is that you've got this survey that you're working with the Department of Statistics. It's been conducted, and what's going to be the expected outcome? Are we going to be shocked by the stats, or what
we want to... actually, there is no statistics in Sharjah or the UAE. We don't have a real statistics of how many children is not diagnosed, even have symptoms of learning difficulties. We started with Sharjah. We worked with the statistics department to at least, shed the light on what is the numbers.
Yeah.
How many numbers of people with learning or symptoms of learning difficulties are there in the schools.
Amazing. So looking forward to it. And let's get to your final thoughts on the first step that they should take, or once they see or realize that their child might be experiencing some symptoms, or even if teachers have alerted them. How long does this process take? Do they drop you a message on Instagram, contact you? How does that step work?
They should go to the nearest center. If it's in Sharjah, Dubai, or anywhere in the world, they need to consult experts who will guide them through. The second, the thing, we have an app in Apple Store and in Android. It's a simple diagnostic test that it's like a questionnaire. A parents can do it, an older child or a teenager can do it, and a teacher can do it with a simple questionnaire. And then once you answer it, it will show either you have symptoms of learning difficulties or not.
Wonderful to see that application. That's a Sharjah Centre for Learning Disabilities application?
Yes, it's SCLD.
SCLD. So download that app if you want to diagnose as well and investigate a little bit further. And, of course, to learn a success story, we have your son, who's in the academy as well nowadays. Now,
yes,
after getting or showing symptoms of learning difficulties.
Yes.
That's good.
So in the beginning, he suffered, and then I suffered with him. But once we had the knowledge of how to help him. He started having more self-confidence. He reads better, and now he knows how to learn. He knows the way he learns better. He puts notes. He speaks with his colleagues. So his memory starts to, he remembers things from people talking instead of, memorizing it in books. So now he understands his difficulty, but alhamdulillah, he crossed it, as you said. But as I said, it will stay with you, but you need to learn how to step over this obstacle.
And what's his name?
Arhama.
Arhama,
yeah.
Well, inshallah, you'll be in Naqib soon. You've got so much to look forward to it. Captain Arhama Al Suwaidi as well.
No, Al-Shamsi.
Al-Shamsi, okay.
Yes.
Well, there we go. So we're looking forward to it as well, seeing such a bright future. Thank you very much once again, Dr. Hanadi Al Suwaidi,
Thank you.
for joining us this morning. And if you've got any particular thoughts and any questions, do drop us a text on 4215, and you'll catch this discussion as a podcast as well as a YouTube podcast. So do stay with us here on the Morning Majlis. You were listening to Dr. Hanadi Al Suwaidi, the Director of Sharjah Centre for Learning Difficulties, here on the Morning Majlis.
If you liked this episode of the Morning Majlis, drop a like and subscribe.
95.
Be sure to follow us on Instagram for all our daily updates and top stories.